Today I'm going to talk about coronary heart disease. Coronary heart disease is also called coronary artery disease, and some people just kind of say heart disease. Um, it's something that runs in my family and is a very, very serious thing that it's hard and difficult to watch somebody go through. I'm going to start out by what is coronary heart disease? Where the heart disease is located, and this is a mass majority of where it's located or where it centralizes. Why heart disease occurs, the process of developing heart disease, what does your body go through as you're developing this, and ideas for a healthy lifestyle as well. Coronary artery disease is usually seen in the environment of the vascular disease, and is also in the systemic process. Not usually as well. It is mass majority of it is found in that area. Within our body, we have one main transport system. It's our cardiovascular system. Our left and right coronary arteries originate at the base of the aorta, at the aortic sinus. Coronary heart disease transpires when there's a buildup of plaque or cholesterol in the arteries within the heart and arteries running to the heart. So imagine a tube that, like you're plumbing, and it all of a sudden everything's corroded. You're sending down grease down the tubes, and year after year it just, the grease piles up, and all of a sudden you have back up of water. It is almost the exact same thing as coronary heart disease. That's exactly what plaque is. And the less, the lower the amount of room volume that the oxygen your blood has to be able to travel through, it ups your heart rate. This is the start of heart disease. Our heart must have an adequate amount of blood and oxygen for our cardiovascular system to operate properly, and that's where the plaque comes in. If plaque buildup gets increasingly just an overabundance in your heart valves, your arteries, it's going to eventually create a heart attack. When plaque buildup narrows the room within the arteries, the capacity and the speed of the blood flowing through our cardiovascular system tends to slow. When coronary heart disease occurs, our cardiovascular system begins to fail slowly but surely. This is due to the lack of the amount of blood and oxygen the heart requires to function properly. Our coronary heart disease could affect if it affects a ton of things. But for example, coronary arteries, peripheral arteries, renal tissue, cardiac tissue, many cells within our body and tissues in our cardiovascular system. The reason why brain cells could be affected is when our blood supply is cut off, it is also cut off to our brain. When this happens, our brain cells start to die. If plaque in our arteries break off, then it lodges into another place in our arteries. This can cause an embolism. Coronary heart disease can cause heart attacks. Heart failure, if severe enough, it can have unintended effects on the rest of our body. Causing stroke, liver failure is also another example. If a person has a heart attack, it could cause insufficient blood flow to the legs and intestines. This is when slowly our body deteriorates and one thing after another begins to happen. In our digestive system, in order for it to function properly, we require the cardiovascular system to carry nutrients and toxins to the liver. When we eat fatty foods, going through McDonald's, going through those fast food restaurants, we tend to increase the possibility of developing heart disease. All of that saturated fat in those French fries that are left behind in our arteries, they leave a buildup of plaque. This obstructs the proper blood flow through the cardiovascular system. Longtime smokers aid to the likelihood of developing heart disease due to the smoke narrowing the arteries in the body. There are ways to assist the prevention of coronary heart disease. When we live a healthy lifestyle, exercising, eating lean proteins like beans, chicken, fish are all good examples that are good for your heart. Of course, we've all went through a drive-through one time or another, but this is when it starts to kick in that we are getting older. All of a sudden, we need more fruits, more vegetables. Whole grains are also good ways to assist in the prevention of heart disease. When a person's overweight and smokes, this increases the possibility for developing diabetes. Diabetes is a high risk. When you have diabetes, you're at a high risk level when it comes to developing heart disease. Women also have very high risk factors in developing heart disease. In our mid-age, if we misuse or overindulge in particular sweets, it is particularly going to, in our older years, it's going to increase the likelihood of heart disease. In the middle-aged, women should eat low-fat, protein-enhanced green vegetables and fruits. Although sleeping should be relaxing, if you snore, your blood pressure, hormones, as well as your nervous system abruptly change so greatly that it does increase the probability of developing heart disease. In addition, children or adults that snore and have bad drinking habits, smoking could result in the consequences of developing heart disease. Coronary heart disease can be avoided. This disease targets a large population of overweight people that have a sizable amount of belly fat. When looking at factors for heart disease, a person should look at how much stress are you enduring daily. Is it your job? Is it your family? What can I do to decrease the amount of stress that I'm feeling on a daily basis? It's a well-known fact that exercise does help that, even if you go for a walk. People with depression should consider for therapy, exercising, and assisting with ways to decrease the depressed or anxiety moments that are occurring because of excessively emotionally or increasingly angry or being agitated. They can all up your heart rate. Thank you.